When you dig a little deeper, you see just how deeply the pandemic is affecting older Mainers. State data show people 70 and older account for about 9% of all COVID cases, but they account for nearly half of all COVID-related deaths. Of the 1,849 people who died with the virus, 922 of them were over the age of 70.
COVID is not the only challenge facing seniors in our state right now. Many are struggling to find the long-term care they need. Now, as we close in on 2 years of the pandemic, many nursing homes are shutting down. Why? Because they say they're struggling to hire the staff they need. The Maine Hospital Association estimates 1 to 2 nursing homes are closing each year, and that's just an average. In September, 4 facilities announced closures. That included Country Manor in Coopers Mills, the Somerset Rehabilitation and Living Center in Bingham, and Island Nursing Home and Care Center on Deer Isle. That was the only long-term care facility on that island. Maine lawmakers are now reviewing a bill that would require nursing homes to notify the state's hospitals if a long-term care facility is planning to close.
As it stands right now, long-term care facilities have to provide a closure plan to DHHS. And once DHHS approves the plan, the facility notifies people who live there, family members and staff.
News Center Maine's Jackie Mundry takes a closer look at how this plan would work.
Nursing home closures can come as a surprise to the community and leave families worried about where their loved ones will go next. That's why Representative Genevieve McDonald is sponsoring a bill that would require nursing homes planning to close to notify local hospitals. She says she saw firsthand how these closures affect families when the Deer Isle nursing home closed over the summer.
Created a tremendous amount of stress for families wondering if where their loved ones would go, if there would even be suitable long-term care placements.
Those in favor of the bill say it's just one more step in the closure process.
Upon notice of a closure, which happens once or twice per year, DHHS write a 4-sentence email that should take about 30 seconds.
And this may be one of those situations where we respectfully agree to disagree.
Angela Westoff, Executive Director of the Maine Healthcare Association, testifying against this bill.
We believe that increased communication and sharing of best practices between hospitals and local nursing facilities may be a better path to pursue, given the delicate nature of facility closures.
Rural hospital leaders like Cindy Wade from Lincoln Health say notifying hospitals can help them better prepare for these closures.
We end up not knowing ahead of time or not knowing timely enough. And so we're getting calls from families and from residents looking for where are they going to go next.
Wade says nursing home residents can sometimes end up in the hospital if they go home to live with family that can't give them the same level of care. Jackie Mundry, News Center, Maine.